Hi, my name is Lavelle Romaine, and I'm one of the nurse recruiters here at City of Hope. We'd like to welcome you to our panel discussion about cultural sensitivity in patient care. City of Hope is an NCI designated cancer center, and we're located in Duarte, California, right outside of Pasadena. We're a research and treatment center for cancer, diabetes, and other life-threatening illnesses. And we're one of the founding members of the National Comprehensive Cancer Network also. I'd like to introduce our panelists first, and then I'll have them introduce themselves and give a brief description about their career here at City of Hope and some of their background. The first panelist is going to be Teresa McCormick. She's one of our nurse recruiters, as well as Leilani Patatzel, one of our nurse recruiters. Cindy Chong is one of our Clin Nurse 3s that actually hired her as a new grad several years ago. We have Lisa Ward, she's also a Clin Nurse 3, and David Rice is our Director of Professional Practice. So what I'll do is I'll start with David, have him introduce himself to you, give a little bit of background and how he's dealt with some of the cultural sensitivity here at City of Hope as well as in his career. David, we'll get started with you.
Sure, thanks Lavelle. Good afternoon everyone. I'm David Rice. I'm the Nursing Director for Professional Practice and Education here at City of Hope. And I've been here just now a little bit over 2 years. In my role with practice and education, one of the initiatives we were asked to take on was to have a look at the Joint Commission's field guide on how to provide culturally competent care to lesbian, gay, bisexual, and transgender patients and families. The field guide was published in 2011 as recommendations for how healthcare organizations can achieve best practice in caring for LGBT patients and families. So a working group within the Practice Council has been looking at the recommendations and will make broader recommendations to the organization. Just that look, though, has really tied in well with some of the diversity groups that Lavelle will be talking about, and some of our other initiatives, one of which is to apply for recognition by the Healthcare Equality Index with the Human Rights Campaign. So lots of nice work going on around the idea of LGBT cultural competence.
Great. How about you, Lisa? A little bit about your journey here at City of Hope and some of the cultural sensitivity that you've had to experience.
Hello, my name is Lisa Ward. I've been working with the City of Hope now for 24 years. It'll be 25 years in January, and primarily on the hematology floor with the adult population. And I love what I do.
Great, thank you. How about you, Cindy?
So I'm Cindy Chong. I joined City of Hope, as Lavelle was saying, about 2 years ago with the new grad program. And I've loved my job I'm on the hematology floor with Lisa, backtrack, and I've loved it every day since I started. I think City of Hope, it's a great place. We're a cancer center, so you have people not only in the catchment area around that we're here, like in the San Gabriel Valley, and in Los Angeles, where there are a lot of certain specific populations that we cater to, but also because it's an oncology center, cancer center institute, we have people from all over the world coming. So we are dealing not only with people distance-wise close here, but around the world as well. So it's a really unique place for me to be in, and I really have been enjoying every shift, or most shifts, in my head, with transfusions and whatnot. But it's a great center and a great hospital to be with.
Excellent. Thank you, Cindy. How about you, Leilani?
I've been here at City of Hope for 4 years, and I primarily do the nurse recruitment for the inpatient side and enjoy what I do.
Excellent. Teresa?
And Teresa McCormick, one of the nurse recruiters, and I've been here for 2.5 years, hired specifically to bring in the peri-op nurses, and then just as I've been here, just going into different departments and hiring great case managers and professional educators, and just been a great experience so far.
Great. Thank you guys all for joining us. So we'll go ahead and get started with our panel discussion. The first topic we wanted to discuss was cultural diversity here at City of Hope. And I'll open it up to each one of the panelists of how you have dealt with cultural diversity as a nurse here. What are some of the things you've seen us do here at City of Hope to impact cultural diversity? And like David was saying, just going that extra mile as far as some of the things that are actually part of a joint commission standard that we are looking at. And what are you finding in cultural diversity as a nurse or a professional practice individual? So I'll open up to all of you guys. What do you want to?
Yeah, I think, well, from my perspective, all of the nurses and patient care services folks who come into City of Hope go through both new hospital orientation for all of the employees, and then they go through a patient care services orientation with my department. So part of the joint effort of human resources and organizational development in my department has been to expand the initial education that's given to new nurses and PCS staff, patient care services staff, related to cultural competence. So that's been part of the focus there with human resources. Beyond that, as I said, has been really what then are initiatives that we can take to educate both patients and families as well as staff throughout the organization about issues related to cultural competence.
Excellent.
And another helpful tool is when we admit the patient to the wing.
Mhm.
There's several questions that we ask them to get to know them, to get to know their cultural preferences. How would they like to be addressed? We offer a lot of religious services or dietary preferences. There's so many things and so many questions that we ask them when we admit them.
What are some of the responses you receive to those questions when you ask somebody during that intake what their preferences are? What are some of the things that you hear that either maybe you didn't know when you started nursing or it was an educational opportunity for you? And you can all weigh in on that. Something that happened to you as a nurse, you did that intake, oh, I'm going to take note of that the next time I take care of someone that is part of this diversity group. Maybe share your experiences in some of those things.
I had a patient who was not part of the intake, but he's been on our floor for a while, and it was my first time taking care of him. And I was very new at the very beginning at that time, and so when I went into to hang my IVs and just doing about my business, the chaplain actually came in and wanted to see they wanted to do a prayer. So I thought that if I go in and just do my because you have a lot of stuff back to back and you don't want to have to fall behind. So what I thought, I might just go in and hang my IV quietly while he prays and stuff like that, it would be okay. I guess that wasn't okay because later on I heard from my managers that he had complained, wow, that nurse, had no respect. And I wanted to just, have a moment to pray. And here she is in my face trying to get her business. She's so task oriented, not being very sensitive to what I need. So I thought that was a great learning experience for me. And since then I was just like, if they're praying, I'm not going in there. I'm going to go do something else.
That's a great example.
Yeah.
That's a great example. Anyone else have examples of how they've encountered cultural diversity while you're doing patient care?
Well, before that, I was thinking of the example that Lisa just gave of the importance of asking patients things like, how do you want to be addressed? And so it just shows really that in order to take care of that patient, you need to know who they are. And even asking, do you prefer to be addressed by Mr. or Mrs. or your first name? It shows that you respect them, and that tends to help to build the therapeutic relationship that you're hoping to build. I even remember examples going across multiple nursing settings. So for example, in a surgery experience, there may be 5 different nurses touching the patient, but one particular unit that would be very intentional about recording things like, how do you want to be addressed and what's your most important concern about this encounter, and making sure that got communicated all the way through to the recovery room. And so the patients just being very pleased that the nurse in the recovery room had that same information about how they wanted to be addressed and what was the most important issue to them at that time. So just that whole idea of primary nursing and really being supportive of the individual and knowing the individual.
That's great. You can have that continuity of care, and then they don't feel like they're repeating the same answer over and over and over again.
And their family unit, because everybody's family unit is so different. But that is so important. We want to establish that right away upon admission. So, we can include them in the care and, everything. I mean, that's so important.
And do you find certain cultures are more apt to want to participate in patient care? There may be a culture that doesn't want to participate. What do you find as far as patient care and the family's involvement? We found that certain cultures are more, even when we'll probably be talking a little bit more about death and dying, and how does the family participate? Have you noticed any cultural differences in the death and dying of a patient care? And what does that look like for you guys?
I recently took care of a set of a family where I guess as far as death and dying, it's for me it's like very general. Obviously the living can't let go of the person who are saying goodbye to the world.
Mm-hmm.
And I think in general we all grieve, but they grieve in different ways, and we try to be very sensitive to those needs. At the same time, I think being realistic with them.
Mm-hmm.
I don't know, it's just a really hard topic to touch upon.
Oh,
death
sure.
and dying.
Everybody's so different. You have to really respect everybody's way they're going about
Mm-hmm.
with the patient transitioning. Because everybody is different, and some cultures are, I don't know, I just, everybody grieves differently. I think,
Yeah, I
we
think we
just
have
have to really respect that.
Right.
we had like a few DNRs on our floor, and still they were following the DNR protocol. You don't transfuse or anything like that, but nonetheless, respecting their religious beliefs or personal beliefs, diversity beliefs and whatnot, we still went ahead and followed,
Mhm.
the caring for that person as far as though they're not on a DNR.
Right. For us as nurse recruiters, one of the questions we ask is, how have you had to deal with death and dying in patient care? A lot of times we get a variety of responses, and a lot of it circles around cultural diversity. As far as how loud a family is, some are very, very quiet in that grieving process. Some are that's their culture to be very expressive of their grief. Some are want to bathe the body after the deceased. What have you encountered regarding that? And then Teresa and Leilani can chime in what we've heard as far as, that's one of the responses I get a lot when I'm interviewing nurses, is being sensitive to culture diversity and how a family chooses to align themselves during the death and dying process. So what have you all encountered with that?
Well, I think to what Lisa was talking about, both from a cultural perspective and a religious perspective, people are going to have different rituals around what the end of life looks like and what the whole death process looks like. So people may have very ritualistic things that they want to carry out, and to the extent that both nurses and the hospital organization can accommodate those. So one story didn't happen to me, but one story I recall about a particular religious belief where you have to open the window and you have to allow the soul to leave the building. And so that's something that the hospital was able to easily accommodate. But otherwise, you could see people may say, no, we can't do that.
The
So
windows
really
are
make,
shut.
yeah, exactly. If the window
I
is
have
still
heard it's gonna
open.
be shut.
Right. So rituals that are just very particular to their culture. Any other thoughts? I had one, but it's.
I took care of a patient where the husband, for whatever reason, the wife was, she's in her process, and you can see she's in a lot of pain. Every time she lays her head down to rest, we found like, oh, good, let her rest, right? Let her be comfortable. The husband comes in and wakes them, pats her like on the back really hard. We're like, what are you doing? But that's his family, I guess, what they follow in the ritual and whatnot. So, we felt like, even though as a nurse, like, you want to advocate for the patient, but at the same time, it's a family. So you kind of caught reaching, like, what do you do?
All right.
Yeah.
Is there a certain place that nurses or healthcare professionals can go to find out cultural differences, to read about it? Are there websites or books that can help nurses be able to know that there's a possibility I'm taking care of a patient that is this particular culture? I should be sensitive to this, maybe their needs. Are there any resources that you could recommend?
So actually, I see Leilani has one there. So this is, so I won't necessarily remember the title of the bigger book, but her name is Jerry Galati. And this small wire-bound publication is on cultural sensitivity. And it really makes the point that you can't use these as iron fast rules, right? So it's not necessarily saying if someone is of one ethnicity, they're going to behave this way, but it's just giving you a sense of how different cultures may approach things like death and dying, like health and wellness, like treating cancer even. So that's a very good resource. On City of Hope's website, the Nursing Research and Education Department has a website called prc.coh.org, which has just a lot of very free to the public and really amazing resources on pain management and on end-of-life care. So all of those are very tied into what is the cultural relevance of those things. Trying to do other particular resources.
That's part of our orientation, is my understanding, is part of our nursing and our healthcare orientation here at City of Hope, to hit on some of the cultural diversity that we may encounter. What does that look like, David, in an orientation day? If somebody was to have a brief orientation about cultural sensitivity, what would be covered during that time?
So again, just the idea of basic cultural and religious and other beliefs that impact how someone relates to healthcare.
Okay.
So in our case, and I think Cindy alluded to our catchment area, so those of you who are from the LA area, this won't be a surprise, but to me as new to the LA area, about 40, so of just the 4 counties, right, Los Angeles, Orange, Riverside, and San Bernardino, that is 17 million people, which is 46% of the California population, and it represents fully 5% of the entire country's population. So it is a very big area. Some 47%, if I'm remembering correctly, are Hispanic, and some close to 20% are of Asian ethnicity. So I think what City of Hope tries to focus on, and as Cindy said, patients from all over the world. Right? So just for staff coming in to really be aware of the fact that we serve a very, very diverse population, and to give some, we don't drill down into, as extensive detail just in the interest of time, but really just an awareness about the diversity that we serve and the requirement for nursing and other staff to really be tuned into the patient's beliefs and how they want to be treated, and how they have learned to access healthcare based on their culture and their religion and their other perspectives.
That's great. Teresa works a lot with our diversity initiatives here at City of Hope regarding bringing a diverse population. David mentioned about our catchment area, trying to hire based on what our catchment area. And so Teresa, if you wanted to talk a little bit about that.
Yes, thank you. So we attend quite a bit of events. We also post on sites that really will bring in really looking to capture Latino, which is Hispanics, as well as African American and Mandarin nurses. And so we have different ways of really pushing the positions out and really going after those candidates. We work with diversitynurse.com. We have minoritynurse.com. We also attend NAN, which is the National Hispanic event, which we did nationwide, as well as attend local chapters. Find a lot of Hispanic nurses that way. We've also attended the Alante Mujer, which is bringing in the younger and educating the Hispanic youth, Latinas, to come in and go towards the pathway to healthcare, really teaching the parents, because we understand that the parents are the main source of helping their teens get into some type of education. And we even focus on trying to bring in the lower levels so that if it becomes where a financial burden on them, we're still trying to help them with that pathway to education for the Hispanics. We also attend college events. A lot of the college events have a diversity group, which really has helped us a lot here at City of Hope. We do a lot. I do believe we do a lot here. We also have an event that is diversity focused, which is our expo, which will be September 26th, and that'll be from 11 to 4. And there we're also doing not only a career fair, but also pathway for the students and parent to come. And this is a great opportunity as well, really helping the community of Monrovia and Doherty to capture the Latinos and Hispanics.
Hey, Lonnie, one of the things that we do here at City of Hope, we have Learning and Personal Development Week, and that's every January. I'd love to highlight a little bit about what's happens there and how we embrace cultural diversity within that.
Sure. For the past couple of years, we actually have Learning and Personal Development Week, and that is taking a week sometime in January where our own employees from City of Hope can learn advanced or basic Excel. There are other classes that they offer, and one class that I did attend was actually the cultural sensitivity training, and it was very, very popular. We had one of our doctors, our medical oncologists, actually go over this cultural sensitivity pocket guide for healthcare professionals. And there were a lot of nurses and people from also the business areas. I was the only one from HR. But basically what that doctor was talking about was, a world is a small place. And, and smaller it gets, the more important it becomes that we understand each other. And now, healthcare professionals, they're taking care of patients globally. So they're coming from, different countries. And when we do take care of them, they're also coming in with, cultures and customs that affect the way that they interpret the world and their experience and their relationships. So, if patients feel we can understand and respect them as individuals, then they'll be more likely to trust us and basically comply with, our prescribed treatments and therapies. So, the greater the trust, the better the outcomes. The better the outcomes, the lower the risk and medical malpractice liability. So they pass out this Joint Commission resource, which David mentioned earlier, and it's called Cultural Sensitivity Pocket Guide, which comes from www.ggalante.org, and it's from the Caring for Patients from Different Cultures by Jerry Ann Galante, PhD. So each section of this pocket guide basically will address, a few core cultural patterns that can lead to misunderstandings. And by using this guide, physicians, nurses, and other healthcare professionals can take an important step towards, better patient relationships. And I'm hoping that we'll have this class again, hopefully in January, because it was an eye opener, and everybody had a lot of questions towards the end, and so there were a lot of. It was very positive.
Great. Speaking of questions, if you are watching online live, you can watch us on Google Plus, and you can submit questions through the Q&A application that you see there. And if you're viewing it on YouTube, the annotations are available on the video that you're seeing. And the annotations will point you to the handout on-air page with the Q&A application if you want to ask a question. If you're joining us on Twitter, you can make sure you add #NursesForHope to your tweets and any questions that you might have, and we'll try to answer those online. We were talking a little bit about certain areas of cultural diversity. We were going to talk about how each family will grieve differently based on their culture, body language, distance, how close proximity you can be to the person, voice tone, your eye contact with the person, how they handle pain, language, spiritual connections. Do you want to go ahead and elaborate a little bit more what you've encountered as a nurse in cultural diversity with those aspects of any of those areas?
I could say something about pain. Pain is really a touchy subject for many people, and most people are very scared to receive any kind of pain medication, even when they're, transitioning to in the death and dying process. So it's that is really important to educate the family and the family members on pain medication. And some people, go the other way. They want a lot of pain medication. But pain is you just have to do very good assessment of the family and what they want and the patient ultimately. We want to have the best comfort as possible.
Very good.
As far, well, to add on to what Lisa was saying with pain, I find that the older generation, whether they're, doesn't matter what culture they're from, but the older generation tend to be more hesitant about getting pain medications. They don't like, the less medication, the better. Whereas the younger generation, they're like, bring me some more, I don't care. They ask for it every hour on the hour if they can have that.
Right.
So it's, I think it's more the age diversity
Okay.
rather than the cultural diversity as far as getting pain medication and how to educate them differently in that aspect.
That's great.
Uh-huh.
Anything for you, David? regarding-
We had talked earlier about food and food rituals, and that reminded me too, and I think actually when Teresa was speaking, it reminded me too about heat and cold. So the way people relate to food that's hot or water that's hot or cold, or even the wind, getting a pasmo. So whether or not one is, so it's essentially health and not health, right? So one relates to health, but it could vary depending on whether it's a type of food or the water temperature or how you're being bathed or how you're being dressed. But food is very prominent for all of us. So it makes sense that as you're approaching treatments like cancer treatments where you may have mucositis, you may have nausea, vomiting, so you're not able to eat so much. And yet, oftentimes the family inclination is to bring food because that's the thing that they perceive as healing. So even if there's not a potential for nutrition to heal, there's still the sort of strong family belief that that's one way to take care of your family.
That's one of the first questions.
Mhm.
Can we bring food?
Can we bring in food?
That's how much, where can we store our food? They want to bring their own food.
Is that right?
Yes.
Very common. So you mentioned earlier that in certain cultures to feed somebody that is ill is their culture, and then others
Yes,
might not be. How does that play out in patient care for you guys?
Well, I don't know. I had a patient again. The son wanted to feed his mom food. She was ordered to be on nothing by mouth, NPO.
Okay.
But the son insists on giving her food, and I was just really trying to explain, at her stage where she's at, giving her food actually probably causes her body more harm than good. And I don't think he understood that. We were trying to be gentle, and then when I was trying to explain the process as gently as I could, he's like, you just threw a bunch of information at me. So I felt like, wow, I don't know. I was like, maybe I wasn't being sensitive enough by giving him realistic information without, leading him to case scenario, giving him false hope and not, or.
Right. Fine line that you walk. Anything with you, Lisa? You were kind of nodding a little bit there about eating.
It's sad because some patients will have like horrible, gastro, symptoms and they can't eat, but yet they really want to eat. I mean, that's like something that they really want, they enjoy, they love, and they'll do whatever it takes to get that food. They're not supposed to eat sometimes.
Right.
Or the family will sneak in food, or they'll find a way to eat.
Yeah.
They really do. The food is important for most
It is.
cultures, and then to eat together and to eat your own kinds of food that you enjoy and like, and
It's true, it is a social event.
it is.
That's great. Any other comments about touch, we've kind of addressed pain. What about spiritual connections, getting spiritual care involved? At what point do you do that? What's available at City of Hope?
Everything. I've had patients have masses in their room,
Okay.
or prayer ceremonies, or healing hands, or Reiki. I mean, every kind of, and everything is available at City of Hope. And we let them know that right from admission when they come into the hospital. Whatever we can do to aid them in their spiritual selection, we will do that.
Great. Any other comments?
So we have a very active supportive care medicine department, and we have a biller patient and family resource center. So providing lots of resources to patients, even, emails will come out to the staff to let them know that they have fleece blankets for the patients or knit caps or something. So just lots of sort of comfort things. chaplaincy, social work, volunteers, psychiatry, psychology, so just a lot of supportive care services.
We even have a hypnotherapist
Yep.
that comes
Right,
to the
yes.
patient's room.
Really?
Kate
That's very,
Kravitz,
yes,
yeah.
she's so wonderful.
Yeah, so we actually have Kate Kravitz as a nurse scientist who works in the Department of Nursing Research and Education. And she actually developed, so it exists for us as a standardized procedure that nurses can activate nurse-led hypnosis
And it's,
protocol
Wow,
it's
that's-
very, very helpful.
for
and
symptom
effective.
management.
It
yeah.
is. She's wonderful.
So that's something I think as we were talking about end-of-life care, we do work in an acute care hospital, but when patients are at end of life, I think it's very important to acknowledge from every perspective, from staffing and administration, that it takes no less time to take care of someone, and it may take more time to take care of someone who's facing death and having to go through kind of the dying process. So even though it's not acute care like we think of it, it still is a time that requires a lot of time and
Right.
attention. So you had talked earlier, Lavelle, about physical proximity and space. So many cultures have different relationships to whether or not you touch each other. In some Asian cultures, you would never pat a child on the head because that's bad luck and it's disrespectful. I had an experience very early in my nursing career where I had a young patient, a father of a lot of children, and his wife, and the patient shook my hand, but based on the family's religion, I extended my hand to the wife and she informed me that she could not touch me. So that was just sort of an on-the-job learning experience about boundaries around gender and age and religion. So,
Expecting that, but it sounds a lot of it is on-the-job training when you encounter various cultures and making sure you're sensitive, and it helps you the next time you encounter that type of patient.
but you're right, there are mandates from the Joint Commission and others about education, not just for nursing, but physicians, medical students. So there are a lot of resources, there are a lot of training programs, and again, it all comes back to that tenet that if you're going to treat me, you have to know who I am. So.
Very true. We did have a question that came in, and the question, excuse me, is how would you address a transgender patient?
Well, I can certainly speak to that.
Okay.
But do you want to? Have you had
You
the
can.
experience?
No,
Cindy or
not
Lisa?
myself, not transgender.
Yeah. So as I mentioned earlier, the Joint Commission Field Guide on how do we provide culturally sensitive care to LGBT patients. So I've been actively involved in a number of years with a number of initiatives back in New York and here, and have worked with a consultant who came out here. Her name is Liz Margulies. She runs a not-for-profit organization called the National LGBT Cancer Network. So it's a network that is looking at the intersection of cancer with LGBT patients. So for transgender people, we know, we know a lot about gays, we know a lot about lesbians. We're learning about transgender people. We know really little or nothing about bisexual people. So for transgender people, it is just for the healthcare provider to really acknowledge again who they are. It's totally okay to ask, what pronoun would you like to be addressed by?
Sure.
Do you call this your chest or your breast? I mean, it's completely okay to feel awkward because it is awkward if you don't have experience with knowing them. But again, then just meeting them with respect, treating them with dignity, and then learning what about their transgender status, what about their transition status from one gender to another, how does that impact their health care? And in our case, how does that impact their cancer care? So it's just, again, being open. There are, you would ask about resources.
Yes.
So again, it's the whole field of cancer and LGBT is spotty. We know some things, but not everything. A book was just published on LGBT in the cancer community. The editor is Uli Bomer, who's at Boston University, and Elnett Relk, who's at the University of South Carolina. So it's in our library. It's available as an ebook, but really the first of its kind in terms of compiling all of this information we know, but more importantly saying what do we not know and what research do we need to conduct to know that we're able to take care of LGBT people with cancer.
Excellent. Great. Several questions have come in, so thank you for your questions. Some of these we may have addressed earlier, but I'll have you guys just hit on some more highlights. Excuse me. The next question is, what training programs would you like to implement for City of Hope nurses? Let David answer that one.
So as I mentioned, we had brought out Liz Margulies as a consultant, and the purpose there was to do a train the trainer. So Liz trained 16 folks throughout the whole organization. She has a very robust training curriculum. She has several videos that she's made that go along with it. So that group, along with the Pride in the City Diversity Resource Group, will come up with a plan about how we want to incorporate LGBT competency training into the competency training that we already do for new employee orientation and new nursing orientation. It's already incorporated, but I think to what extent do we want to go further? And what I would like to do, again, is just make sure that we're addressing LGBT issues in particular, but more importantly, we're addressing what about their cancer care is impacted by their sexual orientation and their gender identity.
Excellent. Thank you, David. The next question says, I'm a student, excuse me, where can I get some more exposure or more knowledge about cultural sensitivity in patient care? I think that you mentioned some books.
Yeah, well, I would say, so Jerry Galante has published, maybe there's a reference in there, Leilani. Pass it down. So she's published a book, and it's now at least in its second or third edition on how to provide culturally competent care to patients. And I would say, particularly as a student, I'm sure it's in your library.
Yes.
It's in paperback and readily available. You could easily find it. This guide that Leilani has, the Cultural Sensitivity Guide, is actually available through the Joint Commission for free. So your university could probably get copies for the students, and most hospitals do have copies for all of their employees. And then I would say otherwise, online resources, if you looked at, probably if you just looked on Google for cultural competence or cultural sensitivity, there is the Fenway Institute in Boston, which is a sort of scientific think tank about social issues and cultural competence. The Human Rights Campaign, which is headquartered in DC, is the largest civil liberties organization in the world, actually, with 1,600,000 members, 1,600,000 members. And they have just a host of information on cultural competence around all issues of cultural diversity.
Great. Sounds like there's a lot of resources available out there. The next question is, how do you leverage diversity resource groups at City of Hope to ensure that you provide culturally competent care? Do they really make an impact?
Teresa or Leilani, do you want to talk at all? Or I can certainly about that. So we, most organizations nationally, and both corporate organizations and healthcare organizations, do have some variation. Some of them call them employee resource networks.
Right.
We call them diversity resource groups. And in fact, they are, when you ask the question, do they work? They're a very good thing for businesses. So essentially they're saying, here are groups of people who have like interests and who work together and who have some sense of community together. Let's support them. Ultimately, though, it's a good thing for bringing in business because of word of mouth marketing, because of your social networks, your family networks. So I may not remember all of them at City of Hope, but we have Pinoys for Hope. We have Latinos for Hope. We have Pride in the City. We have African American.
Asian community group.
Asian community group. We have the Young Professionals.
Young professionals, yes.
So we have 6 or 7 that really do, and they in fact recently had a sort of summit meeting with all of the leadership. They work together for particular initiatives. So the Latinos for Hope, for example, do a school supply, back to school supply drive, and all of the diversity groups participate together. So as I said, most organizations do have them. Healthcare organizations, if you look at corporate America is really far ahead of healthcare America. So it's much more commonly used in corporations, and if it were not profitable for them, they probably would not do it, right? If it's a for-profit corporation. So it really is a way of developing communities, developing engagement within the communities, and then really bringing in business to your business based on supporting your employees. So.
Another thing that I've participated in since I've been an employee of City of Hope is we have Diversity Day every October. And you can sample foods from all sorts of other countries. Each group has their own booth that you can talk to them, obtain resources from them. It's a great day. And one thing that we're going to be doing this year with our nurses and entire staff is we have a map of the entire world. And we're going to have pinpoints, and each employee can say where they came from, where did they get schooling, where did they come from. And the title will be We Bring Hope From, and it will be all of the various countries throughout the world. And that's what pretty much impacts here at City of Hope, that we are bringing hope to the world, not only in research, but also in our patient care, as well as a variety of the employees that come from all over the world to provide that hope for our patients. So I think we do a really good job on Diversity Day. It's a lot of fun. Have music, and this year we're going to try to have a fashion show that will have different countries, that we have different costumes or different types of nursing uniforms that we do. That was another thing we did for Florence Nightingale's birthday, is that we had the nurses wear the uniform where they went to school and what country they were. And we went around and took pictures with a mock-up life size of Florence Nightingale to celebrate her birthday. And we had a lot of fun. So that brings that cultural diversity into City of Hope regarding different countries where people come from and patient care. I think also not only do we focus on patient care, but also in different countries, the training may be a little bit different as far as nursing and the types of nursing. In some countries, nursing care is very autonomous. In others, it's not. So just being sensitive to where someone went to school or what their cultural training was, even as an employee, and working that through even as employees, not, you know, we are very sensitive about cultural diversity within patient care, but how does it impact your coworkers? And where did your coworker go to school? What type of nursing did they have? Is it different from what I had? And respecting that and understand why they do things a certain way, I think is also, as we work to collaborate and have teamwork, is understanding that aspect of it too. And we're getting a lot of questions today. Okay, when you interview candidates, how important is it that they have working experience in diverse areas like Los Angeles? I'll let Leilani and Teresa maybe answer that regarding how important it is. I think that for me, when I'm interviewing, it's more, I'm not looking for the experience, but as a person, are you culturally sensitive? Are you culturally sensitive and respecting different cultures? Can you provide care to a variety of patients? Because I think no matter where you come from, you're always going to have that patient and culture you've never taken care of that might hit you. That, okay, I've never taken care of this one. But it's more, we're looking for that sensitivity. Are you able to be sensitive to the transgender patient? Are you able to be sensitive and respect and provide excellent care regardless of the person's culture, regardless of their beliefs, regardless of their background? And I think for me personally as a recruiter, that's more what I look for as opposed to the experience. I don't know about Leilani and Teresa, but
I think for me, because I recruit mainly for the inpatient side and I recruit for experienced nurses, is I'm looking at communication, and then also looking at where you got your experience, what type of acute care experience do you have? Because some hospitals are much bigger, more high acuity, some are smaller community hospitals. But number one, I think for all of our screenings is really communication, because we know that we get a lot of people here from the City of Hope, from our patients from all over the world. And we do have an international medicine program as well. So that's why we're trying to hire more Chinese nurses that can speak Mandarin or Cantonese or both. And so communication's one, and then also just having that respect on how you respect patients that you taking care of, you know, previously. I mean, we're not going to ask you directly, have you taken care of this type of patient, but through like our behavioral interviewing, that's when we would try to gather that information and see that you would be a good fit for City of Hope.
Thank you. The next question that just came in is, do City of Hope nurses develop strategies to ensure competent care for patients from various cultures? It goes back to our Learning and Personal Development Week, that we're constantly providing our nurses and our healthcare professionals with training. As we learn, I think that, and new things develop, we then pass that on to our healthcare providers here at City of Hope. I think that it's an ongoing process.
And I think a lot of our training efforts are geared just to that, to developing strategies. So we are fortunate to be able to access a number of webinars. There was one series recently which was on how poverty impacts healthcare disparity and the ability to access healthcare. So as I mentioned, for the LGBT cultural sensitivity training, that's again really focused on how do we develop strategies, how do we implement some of the recommendations from Human Rights Campaign and from the Joint Commission to make the care more sensitive to the people who we're serving. So anytime we have an opportunity with a patient population, such as the international program, then we look for strategies to do that. One of them, of course, as Lisa mentioned, is the healthcare record, which is electronic. So you're using healthcare information to support nursing practice, and by being able to ask patients questions about are there issues about how we provide care to you that will impact your care and your ability to receive care that are based on culture or religion or beliefs. We gather that information when we first take the patient profile so that we know how to incorporate that into patient care.
That's great.
And sometimes we do make a special care plan and we put it in the chart.
Okay.
So each nurse that cares for that particular patient will read the care plan. So they'll be, aware of the special needs that this patient has. And we do that. So, we do that too.
That's great. It's been eye-opening for me too, to learn what we do. This is great. Part of this, I think we have already addressed, but the lower part of the question, I don't think we have. The first part, does COH provide education and training workshops to enhance nurses' cultural knowledge about ethnically diverse patients? And I think we've discussed that a little bit. The second part, is there anything available for non-employees or nurses from other hospitals that we offer? I know that the LNAC, we offer the end-of-life training and the certification. We do that, and it's very well known. I know when we go to conferences, everyone knows about our LNAC training, and I think that's a great thing. Any other classes that we're offering outside that would be for other employees?
So coming back to the first part of the question, it raises the question, should we?
Mhm.
Should we take the lead in providing workshops that would be open to the community around issues of cultural competence? Maybe we should. Maybe that's on the horizon.
Thanks for the question.
Thanks for the question. And then, as you mentioned, the End-of-Life Nursing Education Consortium is now in its 15th year. And so keep an eye out again on that website at City of Hope for patient care resources. LNAC is generally offered twice a year for the core, but they offer multiple tracks, so pediatric, critical care, geriatric. They have done special curriculum now for doctors of nursing practice, DNP students. They've introduced it into a lot of school curriculums through the American Association of the College of Nursing. And over the years, they've been engaged. They've been in countries all over the world. And if I have the number correct, there have been more than 500,000 nurses who've been educated by the trainers of this program throughout the world. So just really dramatic efforts to improve the way we care for patients at end of life. The same group also offers the Pain Resource Nurse, the RN course, which is coming right up, September 16th and 17th. This time it's in downtown LA. A 2-day course that's in its 24th year now to improve the way nurses care for patients in pain.
Are those available on our website? If someone were to go on our website, they could see what classes that we're offering for the community.
Yeah. So think it's just, I sometimes invert the letters, but I think it's PRC.
PRC.
Pain Resource Center, prc.coh.org, and it'll take them right to the page.
Excellent, that's great. Any more questions that we have? Okay. There's some items that we'd like to mention to you. Every Thursday here at City of Hope between 7:30 in the morning and 2 o'clock in the afternoon, for experienced oncology nurses, we're offering walk-in interviews. You do not need an appointment. You can come in and either Leilani or Teresa and I guarantee you an appointment. If we have a good fit with our current openings, then we will immediately take you to the manager based on their availability or schedule an appointment for you to come in at a later time. But kind of a great thing, we get to meet you, you get to meet us, you get to see our beautiful campus. So we do want for all nurses that are experienced in oncology to make an effort to make it to one of our walk-in interviews. And our address is 15 East Duarte Road, and that's in Duarte, California. And the zip code is 92010. And you can obtain more information on our website about that, or you can go ahead and apply online before coming in too. But feel free to contact us if you have any more information that you needed. The other thing that Teresa mentioned is we are having a Diversity Healthcare Expo Saturday, September 26th. It starts at 11 o'clock. It will go to 4 o'clock in the afternoon. Again, located on the main campus at City of Hope. There is registration available through our website. And it's great for the expo will host other hospitals will be here if you want to explore career opportunities. And I have my little Vanna Whites here showing the information. And so do look on our website for those. The other thing is that we do the tweet chat once a month. It's always going to be the fourth Tuesday of the month. And our next one is going to be on September the 22nd. So we want to thank you for joining us and thank our panelists. Any other things you'd like to comment before we log on?
Thank you, Lavelle.
Thank you, guys.
Thank you. It's been a pleasure.
Any other questions that we have? Okay, thank you very much.